Okay, today we are moving on to talk about the circulatory system. Instead of doing Chapter 8, we're going to do Chapter 9 first, which is blood. Blood is what kind of tissue? Connective tissue. Okay, so what are the main parts of a connective tissue? The matrix, ground substance, okay, and the cells. Okay, so blood is made up of cells. We've got our granulocytes, like our eosinophils, neutrophils, basophils, and then we've got our erythrocytes, our red blood cells. So those are the cells, and the matrix that they're sitting in is called what? Plasma. Okay, so it's a connective tissue made up of plasma and cells. Okay, now blood is just one part of the circulatory system. Next week we'll talk about the other parts, such as the heart. Okay, what is the purpose of the heart? To pump blood. Okay, that's how the blood gets through the body. How many chambers does a mammalian heart usually have? Four chambers. Okay, and then we have the blood vessels. The blood vessels are basically just the tubing, the pipes to get the blood where it needs to go. What are the three major types of blood vessels? Arteries, veins, capillaries. Okay. Can somebody give me a definition of an artery? Carries blood away from the heart. Okay. A vein carries blood to the heart. And capillaries are the site where exchange happens. If you're not getting this right now, don't worry. We've got a whole separate lecture on that. But just want you to get the three main parts are the blood, the heart, the blood vessels, and together that makes up the circulatory system. Okay. This is a really important system, right? When you think about you've got an animal under anesthesia, what are the other body systems that we know about? Respiratory system, digestive system, reproductive, nervous. Which systems are we monitoring while that patient's under anesthesia? Yeah, respiratory and cardiovascular. Do we care about the digestive system so much? Oh, he's got a little bit of an upset stomach. We might want to give him, because that, digestive system, reproductive system is not going to affect the animal's health immediately. Whereas if we have a problem with circulation, if the heart stops pumping, if the blood's not getting to where it needs to be, or if the animal's not breathing, that can lead to death very, very quickly. And so that's why the vital signs that we focus on are mainly with the respiratory and the cardiovascular system. Okay, so functions of blood. You probably already know that blood carries oxygen, right? Okay, it carries oxygen to the tissues. Okay, that's the function of our red blood cells. But it also carries nutrients. Okay, think about blood glucose. Okay. As glucose is generated through digestive processes, we're carrying that glucose to the cells, and those cells are taking up that glucose. Same with amino acids and proteins and things like that. It's also important for transporting waste products. Okay. When the muscle cells produce, for example, pyruvic acid due to metabolism, it helps to transport that to the liver. It also is very important for distributing body heat. Okay. What happens to your skin when you become overheated? You sweat, but you also become flushed. Okay, so blood vessels can carry blood to the skin when an animal's overheating. Those capillaries in the skin will dilate and help to bring heat towards the surface. So it's an important way to distribute heat throughout the body. And blood is also really important for pH buffering. Anybody know the average pH of an animal? Yeah, 7.35 to 7.45. That's the range in which most mammalians, their blood is going to be. If we get beyond that one way or another, we're in trouble. We're out of homeostasis. And so the blood is very important for buffering the pH of the body. Okay, one of the things you're going to do in lab, if not this semester, next semester, is you're going to spin blood down. You'll take some whole blood, withdraw it from an animal, and you'll spin that down in a centrifuge like this, and then it will settle into what we call the formed elements, the cells, and everything else, which is the plasma. Okay, so you're going to measure the ratio of cells to plasma and get a value called the packed cell volume or the hematocrit. And why is this number important? Does anyone know? So we see that this blood is about 50% cells or 45% cells and the rest is plasma. What are the majority of cells in the blood? What kind of cells are they? Are they white blood cells, red blood cells, or platelets? Red blood cells. And what's the primary job of red blood cells? Carry oxygen. Okay, so by knowing the relative concentration of red blood cells to plasma, we know a little bit about the oxygen carrying ability of that animal. Okay? And there's normal values for cats and dogs and stuff like that. We want to think somewhere between 35 and 45 is a rough rule of thumb. And if it's below that, it could tell us that that animal is anemic or something like that. Okay, so backing up a little bit, we're talking about blood today, but there are also other fluids of the body that are really important. Intercellular fluid, which is within the cells, interstitial fluid, which is between the cells, and then lymphatic fluid. Lymph is different than blood in that it doesn't really have that many cells in it. Usually doesn't have any cells except for some types of lymphocytes. And it also has a smaller concentration of protein. Anyway, we're going to talk about how these four fluids are created. So here is a diagram of a circulatory system circulation. We've got our arterial end there, our venous end there, and our capillaries in the middle. And what's the main job of capillaries again? Yeah, exchange of nutrients, whether that's oxygen, carbon dioxide, glucose. Okay, they're very permeable and they allow stuff to move out of the blood into the interstitial spaces and eventually meet up with the cells. So here's like a diagram of what a capillary would look like. You can see that the walls are a single cell layer thick made of simple squamous epithelium. And here's all our blood cells. Okay? And the green things in here are proteins and stuff like that. Now, this blood vessel is permeable, so some things leak out. The cells are generally too big to leak out, but what does leak out is some water, a little bit of ions, whether we're talking about sodium or chloride, and sometimes some very, very small proteins. Okay? Once that fluid leaks out in the interstitial spaces, what's going to happen to it if we don't suck it back up? We're going to get swelling. What do we call that when we have swelling of interstitial fluid outside a blood vessel? Edema, right? Okay. That's swelling of lymphatic fluid or interstitial fluid, and you get this, swollen extremity oftentimes. I remember my brother, looked at a relative once. He's like, "Oh, I got this thing on my leg. Would you look at it?" And my brother's like, "Oh yeah, you got some edema." And he's like, "A demon? I got a demon in my leg?" But anyway, it is an accumulation of lymphatic fluid or interstitial fluid. So usually we have a couple ways to suck up this excess fluid. One is through reabsorption, which we'll talk about in our next lecture. But the other one is that we have this second circulatory system called the lymphatic system that helps to suck up excess fluids. So any excess interstitial fluid that accumulates and is not reabsorbed in the blood vessels will eventually make its way into lymphatic vessels and become lymph. Okay, we'll talk more about lymphatic system next time. There's the 7%, which is when we use pounds usually. The easiest way is actually to use 75 mils per kilogram. So when we were talking about that horse with 454, that's why I wasn't giving the number that I thought we should be getting. So 454 kilograms or 1,000 pounds, and we multiply that times 75 milliliters. Now what do we get? 34,050. Okay. So that's 34,000 milliliters. Okay, how many liters is that? 34, right? 1,000 milliliters in a liter. So this is 34 liters. Okay. Generally, we can take 10% of blood volume without having to worry too much. So we could take how much blood from this horse? No, you don't want to take all 34 liters because then we have a problem. You could take 3.4 liters. Why you would ever need 3.4 liters of blood? Okay. Most blood machines are going to run on, less than, a half a mil for most things, or 3 mils at the most. But yeah, because it's a horse has a large blood volume, you could get around 3.4 liters, and that would be 10%. Now humans, think about what your average human weighs. Just give me weight in pounds. 150, okay. Divide that by 2.2. 58? 68. Is that what you said? Okay, so 68 kilograms for the average 150-pound person times 75 mils What does that come out to be? 5,100? Okay, 5,100. So, or 5.1 liters. And that's about right for humans, somewhere between 4.5 to 6 liters of blood per an individual. Guys have a little bit more, okay? So how much blood could you safely take from this person? If we were going to say a half a liter, 500 mils, right? Okay. Which is about what we give when we donate blood. It's around 450 milliliters, something around that. So one of the things you will have to do in a veterinary clinic is look at an animal and say, this is its weight, how much blood can I take? Now for a big dog or even a really big cat, it never makes a difference. But if somebody brings a bird in and the doctor says, well, you know, we need to do some serum chemistries on this bird, and you're like, well, I should probably, you know, normally on a dog I take about 3 milliliters of blood, so we'll just go to this, you know, bird and take 3 milliliters of blood, and when, you know, when it does that, you know you've taken too much, okay? All right, so blood is a connective tissue. The proportion of plasma to cells differs depending on species and also sex. In general, the liquid component is about 60%, 50%. There's a wide range. It just depends on the species. And then the cellular component is anywhere between 25 to 55%. Differences between dogs, cats, and also livestock animals. Okay. Now, of those cells, the formed elements, 99% or more are going to be red blood cells, because the primary function of blood is to carry that oxygen. The remaining 1% or less are going to be white blood cells. And when you spin that blood down, you'll see that there's a layer between the red cells and the plasma. It's a little white layer. Anybody know the name of that layer? The buffy coat, right? So that's what Buffy the Vampire Slayer wore when she was very cold, is the buffy coat. And there we see it right there. Buffy coat is made up primarily of white blood cells because they have a different density than red blood cells. Okay, so blood is made of cells, and it's also made of plasma. What's in the plasma? Well, the plasma is mainly water, over 93% water. Okay, and the rest are plasma proteins. Okay, these are things like fibrinogen, albumin, okay, and we also have some immunoglobulins. Where have you heard of albumin before? It's a protein, sure, but you've heard of it outside this class. It's in eggs and egg whites, right? So that is a protein in your blood, and it's very important for maintaining osmotic pressure. Or immunoglobulins are there for immune defense. These are our antibodies, and we'll talk about those later on. And then fibrinogen is just a protein that helps with blood clotting. Hello. Okay, other plasma components that are minor components, but still very important. We've got our nutrients such as carbohydrates, glucose, amino acids, lipids, vitamins, hormones in there, as well as metabolic wastes. Now it's interesting, you think, okay, these are in minor amounts, but people in here that have given blood for a lab test, did they give you any instructions before you came in to give blood? Yeah, they want you to fast beforehand, and or they don't want you to fast, depending what blood tests are running. So I went in one day and I'd forgotten to fast. I'm like, oh, no big deal. And I'm like, you fasted? Yeah, I did. I fasted. And I gave the blood sample. She's like, you lying, aren't you? Because when you have particularly a fatty meal right before you give blood, and you look at the blood itself, it will be cloudy because of all the lipid molecules in there. So a really good phlebotomist or lab tech can tell whether or not you've actually fasted because of the amount of lipid in there. Okay. While I'm on the subject of plasma, we need to talk a little bit about plasma expanders. We said the purpose of blood, main purpose is to carry oxygen, but sometimes we need to buffer the blood's volume because we had blood loss. Okay, give me an example of something that can cause blood loss. Trauma. Something's hit by a car. We've lost a lot of blood, and not only does that affect the oxygen carrying ability, it also affects the pressure, right? Okay, blood pressure is important. If we don't have enough pressure, the blood doesn't get to the brain and that animal will die. So we don't necessarily always have blood laying around the clinic that we can transfuse, but we do have fluids that are in there, whether we're just talking about regular lactated ringers or isotonic saline. But we also have other things called plasma expanders that help to boost the volume of the blood and help keep the pressure up. Now this is something more for one of your higher level classes, but next time you're in the veterinary hospital or even downstairs, take a look at what's written on those bags. Some of them are just saline, but sometimes we have things that have starch and things in there. So they're all different types of plasma expanders. Okay, serum versus plasma. So plasma is a straw-colored fluid that we can observe when blood separates. Now we can just spin it down in a centrifuge, or we can actually just let it separate because blood is actually a colloid, right? It's going to eventually settle out, or suspension rather. On the other hand, serum is blood that has been allowed to clot and then it's spun down. And the only difference is that serum is plasma with the clotting factors removed. The fibrinogen's gone, all that stuff's gone, but it looks darn near the same. But a lot of times in the veterinary clinic, we'll either test the plasma or we'll run tests on the serum. We run a lot of serum chemistries in the vet clinic. Okay, these tubes, in your second semester, you will get very familiar with the different colors of these tubes. So these are phlebotomy tubes. We have things that go all the way from what we call lavender top tube and to what we call a tiger top tube. Lavender top tubes are for storing whole blood. They have an anticoagulant in there. And tiger top tubes don't have any anticoagulant. And so we put blood in there that we want to clot, and we let it sit there for 15 or 20 minutes, and we spin that down, and all the packed cells go to the bottom, and what rises to the top here is serum. Okay? So it's just the same as blood plasma, except the clotting factors are gone. So I'll bring some tubes in. We can later on look at it, but certainly when you go on to take Sam's 151 lab class, you'll begin to learn all these different tubes and why we use one tube and not another. Okay, I told you before that a phlebotomist or a good lab tech can tell a lot about what you've been up to by looking at your blood. And that's true, particularly when we spin that blood down and we get either serum or plasma. So normally serum or plasma is straw colored. And so that's a really healthy sample there. This, let's say, is our buffy coat, which is our white blood cells, and these are our red blood cells. Now, let's look at this plasma here. How's the color different? It's redder, it's pinkish. So this one would be hemolytic. Okay? We've had hemolysis going on, ruptures of red blood cells, and what's inside a red blood cell that makes it red? Iron and hemoglobin. Okay? So when we've had hemolysis, we've had rupturing of blood vessels, we're going to have a little strawberry pink thing going on there. Now oftentimes, especially when you're new, this is because you've been jabbing that animal 5 times to get that blood vessel, and so you've caused the hemolysis, and bad tech on you. But if you're a really good tech and you still get hemolysis, you want to think about, is there a process going on inside that animal's body? But oftentimes this is caused by the blood draw itself. And then we can get a very dark sort of yellow to orange serum or plasma, and this is called an icteric state. Okay? We see this in patients with liver issues. So you've heard of jaundice, right, in people that gives them the certain complexion, the dark yellow mucous membranes. We can see the same thing in cats and dogs that have liver problems. And then you can have something where I told you it could be cloudy. This would be a lipemic serum, and it's just because that animal's eaten a high fatty meal recently. Okay, so formed elements of the blood. Now, normally we call these cells, but in all honesty, they're not all cells. Okay? Some of them are just fragments of cells. For example, thrombocytes or platelets are not actually cells, they're just parts of cells. Everything else here is pretty much a cell. Okay? And so the cells that we have, or formed elements that we have, are the erythrocytes, our red blood cells, and then our leukocytes, or white blood cells. And then finally we have our platelets. Does anybody know the other name for platelets? Thrombocytes, okay. Thrombus is a blood clot. A thrombocyte helps us to clot the blood. Okay. Where do these red blood cells and white blood cells come from? Bone marrow. The red bone marrow. Okay. If we're looking at a neonate or a fetus, they're making a lot of the blood in the spleen. But if we're looking at an adult animal, the blood is being made only in the red bone marrow and the ends of the long bones, also in the hip bones as well. And so we have special stem cells in there called pluripotent stem cells. And what do you think of when you hear the word stem cell? Research, right? You know, people taking cells from unborn fetuses and things like that. In truth, there's a lot of other stem cells inside the body. These stem cells can become not any cell in the body, but they can become any type of blood cell. And so they reside within the red bone marrow, and they differentiate down different paths. We can become a protoerythroblast that will eventually become a red blood cell. We can become a megakaryoblast that will become eventually a thrombocyte, or a lymphoblast that will eventually become a lymphocyte. So there's all these different avenues to go down to become this cell or that cell. But all of these cells are derived from these stem cells within the red bone marrow. Okay, erythrocytes are the most numerous one. We already know that red blood cells' main job is to carry what? Oxygen. So they pick up that oxygen in the lungs and they're going to drop it off in the tissues. And the oxygen-carrying pigment is hemoglobin. Okay. Now, another thing you should know about red blood cells is they're small, around 3 to 7 microns. So we're talking about 7 microns in dogs, smaller in cats and horses and things like that. So why is being small good? More surface area in proportion to volume. Okay, we also have this sort of, it looks like a Cheerio, but it's not completely punched through in the middle. We've got this depression there called central pallor. It's just a divot that gives the cell more and more surface area, and so that it helps it to carry more oxygen. It also makes the membrane more flexible, because some of the blood vessels that these cells are going to go through are so tiny that the cells have to go through in single file. So having this sort of biconcave anatomy makes it easier to get through really tiny blood vessels. Now the interesting thing is that most mammalian blood cells, red blood cells, the mature ones don't have a nucleus. It's just a big bag of hemoglobin. Most of them also don't have any organelles. Okay. If we don't have, let's say, endoplasmic reticulum, we don't have a Golgi apparatus, we don't have ribosomes, what does that mean for us as a cell?
Not going to last long.
Not going to last long. Okay, as a result, most red blood cells don't last long. They're just these big bags of hemoglobin to carry oxygen. Now, some examples, some animals where you will see nucleated blood cells, fish, my favorite, birds and reptiles as well. They have these elliptical red blood cells that have a nucleus. Okay, so hemoglobin is the molecule carrying the oxygen, and one red blood cell can carry about 1.2 billion oxygen molecules. Really, really efficient. The color of the hemoglobin changes depending on whether it's oxygenated or deoxygenated. So here's a deoxygenated sample, and here's an oxygenated sample. So when you draw venous blood, what is it going to look like?
Bluish.
It should look bluish. If you start drawing blood and it's bright red, maybe you're in the wrong blood vessel. By and large, we're only going to draw venous blood. There are some occasions where you might have to do an arterial stick, but that's a little bit more dangerous, a little bit dicier, and changes color as it loses or gains oxygen. Now, because red blood cells don't live so long, we're making a lot. Okay, depending on the species, you're making up to 2 million cells every second just sitting here. Okay, so the percentage of blood occupied by cells, we said earlier, was the hematocrit or packed cell volume. Now, you'll hear these things being used interchangeably in the clinic, and that's fine. Technically, hematocrit is something that is calculated by a cytometer, an automated machine, whereas the packed cell volume is something that you can compute on your own with a few simple pieces of lab equipment. So cats and dogs are the ones that I want you to know. Dogs are somewhere between 37 to 55% of their blood is made up of cells, and cats somewhere between 24 to 55. And again, the packed cell volume is important because it tells us the relative oxygen carrying ability of that animal. Okay? And it's a really simple, really cheap test to do, because if you have an animal come in and its normal hematocrit is in the 37 to 55 range, and you have that animal come in with a 25% hematocrit, that indicates that animal is what? Anemic. Okay, and you better think twice before putting that animal under anesthesia. And you also want to think what caused that anemia and how can the doctor treat that anemia. Now, the opposite of anemia is something called polycythemia, which is where we have too many red blood cells. If a normal hematocrit is, let's say, 45, all of a sudden we see a cat with a hematocrit of 60. That would be unusual. Okay? Now, there are some weird processes that can cause an actual polycythemia. A lot of times, it's more often going to be relative polycythemia. That is, oftentimes we don't have more red blood cells, but what we do have is less plasma. Okay? And what's the main component of plasma? Water. So if you see an animal comes in and he's got a hematocrit or a packed cell volume of 65%, you know, like either he's Lance Armstrong or, yeah, or that animal has lost some fluid. And how could you assess whether or not that higher hematocrit was due to fluid loss or another factor? Yeah, you could do those tests for skin turgor, tinting their skin. You'll learn about these in your nursing class. And so if you saw a dehydrated animal, you should be able to see that it's dehydrated in other ways too. Okay, so this is what whole blood looks like. Again, we're going to spin it down in our centrifuge, and we're going to get our serum or plasma on top, our buffy coat with our white cells, and then the red cells on the bottom. So if this is normal, it looks like about 40%. Okay, this would be abnormal. This looks like about 15 or 20%. Okay, this animal would be anemic. And you want to ask yourself, why is the animal anemic? What could be causes of anemia in an animal?
Worms.
Worms. Absolutely right. If we have a huge worm burden of parasitic worms, they can suck that animal dry. Even a very huge load of fleas can cause anemia as well. Anything else? Injury, blood loss, yeah. Other types of things can cause anemia as well. But certainly you want to think about how has it been losing blood. And then finally, this is polycythemia. You know, if the normal is 40 and now we're seeing 60, the most common thing you want to think about is that animal dehydrated in any way? Okay, hemoglobin itself is made up of protein. That's the globin part. And the heme part comes from the 4 iron atoms that are in there. Okay. And so these iron atoms can combine reversibly with 1 oxygen molecule. And we have a lot of hemoglobin molecules within each red blood cell. Okay, so hemoglobin is important for a couple reasons. Obviously, it carries the majority of the oxygen in the body. It also carries a little bit of carbon dioxide, but it also carries a little nitric oxide. Now, where have you heard of nitric oxide before? The dentist. That's very good. That's actually nitrous oxide, but you're thinking the right area. Nitrous oxide is what, you know, that comes in what?
Knockout gas.
And knockout gas, and also I think, isn't that what's in the whipped cream containers? You ever, you know, the canned whipped cream?
Once you do this.
Yeah, you never knew anybody in high school that used to do whipped cream? No, okay. Anyway.
Did you?
I don't know anything. So nitrous oxide is a gas that we use for sedation and anesthesia. Nitric oxide is a gas that is a potent vasodilator. So it tells blood vessels to expand, increasing their diameter, and that helps to lower blood pressure. So that's one of the minor functions of hemoglobin. Okay. So the life cycle of red blood cells is a hard one. They don't live very long because they don't have much in the way of organelles. So depending on species, they can live for as little as 68 days in cats, to 110 days in dogs, all the way up to 150 and 160 days in some livestock animals. In humans, it's about 120 days. So they're not living very long. They wear out as they go through blood vessels, and they bend, and their membrane deforms. And if they were any other cell, we could repair that membrane. But hey, these cells don't really have any organelles, so the membrane breaks down, they eventually are going to rupture. And when they do, that usually happens within the spleen. Okay, the spleen is the place where we tend to recycle a lot of the worn out blood vessels. The spleen and also the liver. Okay. So we're making millions of red blood cells a day, which means we're recycling millions of red blood cells a day. And the stuff that's inside a red blood cell is valuable. We've got our protein, our hemoglobin, and we've also got the iron. Okay? Iron's valuable because it's sort of a scarce nutrient, but also for the reason that if we have iron released into the blood outside of the red blood cells, it can actually be quite toxic to the kidneys. So the body has this unique way which to sequester and bind up to all the things it wants to hold on to and only excrete the waste products that it doesn't want to hold on to. So if we start here at number 1, a red blood cell dies and is phagocytized, broken down inside the spleen. Okay. We release the iron-containing heme group. That's transferred to the liver by this molecule called transferrin. Okay. The globin molecule is broken down into amino acids. Those are recycled. And then the other part of that pigment, of the hemoglobin, travels to the liver and becomes something called bilirubin. That's that sort of yellowish pigment that we see in icteric blood and also people with jaundice. Eventually, that bilirubin within the intestine is transferred into something called urobilinogen, which may be excreted into the urine, or urochrome. This is the reason why urine is, yellow, urochrome. Okay. Or within the digestive tract, it becomes stercobilin. What color do you think stercobilin is? Brown. So now you know why poop is brown. Okay. Poop is brown because that pigment was derived from the red pigment in red blood cells, but it got changed into a brown pigment called stercobilin within the digestive tract. All right, erythropoiesis is the process where we make red blood cells. Okay. Red blood cells, like the other blood cells, are made within the red bone marrow. Okay. And the primary stimulus for erythropoiesis is hypoxia or hypoxia. What does that mean? Low oxygen. Okay. So the kidneys actually have oxygen sensors that are monitoring the blood oxygen levels, and when they get too low, they secrete something called erythropoietin, or EPO, which is a hormone which basically sets the rate at which new red blood cells are going to be made. Now, these red blood cells start out in the bone marrow as those stem cells, right? And they start out having a nucleus, and then while they're in the blood, that nucleus is eventually ejected while in the red bone marrow before they enter circulation. Okay, so this would be a mature erythrocyte. This would be a rubroblast. Okay. Remember, blast just means immature cell. So the rubroblasts or erythroblasts are immature red blood cells, and they eventually eject that nucleus and then move out into peripheral circulation to become erythrocytes. So here are some erythrocytes that we can see. These are normal red blood cells here and here. You can see this central pallor there. It just indicates it's a biconcave structure. And then every so often you might see a cell that looks like this. This is called a nucleated red blood cell, okay, or NBC or NRBC. And very unusual to see a lot of these in the blood. Okay. Usually if we see a nucleated red blood cell in the blood, it indicates that the body is responding to prior blood loss or prior anemia. Okay. The same thing is if we use a special stain on the blood, we're going to see a certain proportion of new red blood cells that still haven't chucked out all of their organs, or all of their organelles. Does anybody know what these cells are called? These guys with the arrows on it. So we'll use a special stain. Now you can see that they have organelles where the rest of the cells do not. Reticulocytes. Okay. Reticulocytes. Okay, reticulocyte is a new red blood cell, and particularly when the body is responding to an anemia, when it had blood loss in the past, but now it's trying to catch up, we'll see a lot of these reticulocytes within the bloodstream. And so, if you have an animal come into clinic and the doctor says, wow, this animal has a packed cell volume of 25%, it's anemic, well, let's do a blood smear. Let's look at that smear. Oh gosh, we see a lot of reticulocytes. Well, it does mean that that animal's anemic, but it seems to be responding to that anemia by producing more blood cells. And when it produces more blood cells, you tend to see more reticulocytes in circulation. So that's a good sign.
And they'll just spit out their organelles and turn
Yeah, they'll spit out their organelles and continue to then function as red blood cells. If you see a lot of these RBCs in there, that can indicate too that it might be responding to an anemia, but it's unusual to see a lot of them in there. The other thing is you can see some of the cells are different sizes. That happens sometimes as well when the body's really trying to crank out as many blood cells as at once. You know, it's like if you go to Jack in the Box, like while they're getting slammed, you know, and normally you're used to get the Jack in the Box burger with everything looks right, and you go there at like 12 p.m. and the lettuce is on top of the bun, and they just don't care. Okay, so that's kind of what's going on inside the bloodstream, is that the body's trying to crank out so many red blood cells that some of the immature guys are showing up in what we call peripheral circulation. Okay, so the stimulus for producing blood cells, or red blood cells anyway, is hypoxia. Hypoxia is sensed by the kidneys, and the kidneys talk to the red bone marrow using a hormone called erythropoietin, or EPO, and erythropoietin stimulates the production of red blood cells. Now, as the number of red blood cells entering circulation increases, what does that do to the blood oxygen levels? Well, let's look at it again. What was the stimulus for erythropoiesis? Hypoxia. If here's the normal oxygen, this is optimal oxygen, and all of a sudden we start to drop, at some point the body is going to detect that, and it's going to increase the production of what? Erythropoietin from the kidneys, EPO. At that point, EPO levels increase, and that's going to increase the number of red blood cells, and eventually, when we reach that same set point, the levels of EPO are going to fall off, right? Because we don't want too many red blood cells in circulation. Why not? Too much oxygen? Yeah, that's it. I mean, think about blood is a tissue, but it's a connective tissue that has to flow through these little tubes, right? And the thicker it is, the harder it is to go through those tubes. And so there's this trade-off between having too many red blood cells and not enough. Okay, if we have too many, it's actually physically very difficult for the blood to go through the small blood vessels. Okay, now you've heard of athletes sometimes that are like train at high elevations where there's a smaller partial pressure of oxygen. The reason they do that, you know, normal packed cell volume for a human male, because males have a higher packed cell volume, is around 45. But if they go up to these high elevations, and they have to train for about a month. And because of the lower partial pressure of oxygen, their body detects, oh, okay, oxygen's lower here. Has anybody been at altitude and tried to breathe? Yeah. Yeah, you're like, right. So, you know, going for a week is not going to do you any good. But if you stay there 5 or 6 weeks, their body compensates by producing more erythropoietin, and it raises their hematocrit. And if they come down like 6 weeks later and then, you know, run a race in Baltimore or someplace like that where they're at sea level, they think it gives them a little bit of competitive advantage just because their hematocrit's a little bit higher. Okay, so this is Epogen or Procrit. These are synthetic forms of EPO. And it's important to realize that you probably won't see these a lot in the veterinary clinic. There are no veterinary forms, but it is sometimes used in the clinic, but it's not approved for animal use by the USDA. And so we call it extra label use. What does that mean?
In a way it's not written on.
Yeah, not intended for. But it's okay. It's within, you know, the doctor's purview to do it. They're kind of stepping out on a limb, but you know, certainly if you have a very anemic dog, yeah, it might be something they want to consider. Okay, anemia, we can detect it by looking at the packed cell volume. Another way we can detect anemia is looking at that animal's mucous membranes, its gums. This is unusual. What color should this be? Pink, okay? So it should be pink. It's white. That's a bad sign. When you get into lab in your second semester, you'll learn how to do a little test where you just push on the gums, and you should pull your finger away, and within a second or two, the red coloration, pink coloration should come back. If not, it could indicate a circulatory problem. different types of anemia. The one we talked about already was hemorrhagic. Basically, we had an animal that's had trauma, had blood loss. That's the problem. We can have hemolytic anemia, where the blood cells themselves burst and lyse, and we're going to have a free hemoglobin in the blood as well. And we can even just have iron deficiency anemia. We can have enough red blood cells, but sometimes those blood cells don't have enough hemoglobin, and that's a form of anemia as well. So anything that compromises the animal's ability to carry oxygen can be considered an anemia. Okay, on to platelets. Okay. Platelets' job is hemostasis. Hemo means what? Blood. Stasis. In this case, it means, to stay the same or stop, to stop bleeding. Okay? Because blood vessels do rupture sometimes. Even micro ruptures, and so platelets and some of the plasma proteins have the job of preventing blood loss and stopping blood loss. And so those cells or cell fragments are called thrombocytes or platelets. Okay, they're derived from those megakaryocytes within the red bone marrow. The megakaryocyte's a big cell, and then it ruptures into lots of little fragments that enter circulation. So here you can see the platelets. Remember, the red blood cell was about how many microns? 3 to 7. So let's say this is a dog or a human. This is 7. And so these things are just a fraction of that. So they're probably a half a micron to a micron or 2. So very, very small. Normally they just float around in the blood until something happens and a blood vessel ruptures. When that happens, you'll see that they sprout these little arm-like appendages called pseudopodia, and they grab hold of one another. Okay? And they start this clotting cascade through a process of positive feedback. What is positive feedback, and how is it different than negative feedback? Yeah. Instead of trying to bring us back down to homeostasis, in this case, when one platelet becomes activated, it bumps into another plate, activates that one. They're like, hey, hey, hey! They're letting each other know. And so we have this brief period of positive feedback that helps to stop the blood clot. Okay, so the steps involved here are we have something called a vascular spasm, platelet plug formation, and then blood clotting. Okay, vascular spasm. Blood vessels are made of 3 types of tissue. They have endothelial tissue on the inside, usually a little connective tissue, and oftentimes some smooth muscle tissue. Now, if we have a blood vessel that breaks open, think about, cutting yourself shaving, so not like a giant blood vessel, but you cut yourself shaving, blood's leaking out. The smooth muscle in there will constrict just a little bit as a result and reduce the amount of blood loss so that we can have time for platelet plug formation to occur. Now, this doesn't do you much good if we're saying this is like the femoral artery or something like that. You can't be like, oh, the vascular spasm will take care of it or anything like that. By the time that happens, you've lost too much blood. Okay, the next thing that's going to happen is our platelet plug formation. So we had a break in a blood vessel here. Let's think, cut yourself shaving. Now, normally, what type of tissue are platelets bumping into on the inside of the blood vessel? Epithelium. Okay. But all of a sudden, that blood vessel's broken. We've exposed connective tissue and stuff like that. And so if I'm a platelet and I'm bouncing around a blood vessel, I'm like, oh, hey, epithelium. Hey, epithelium. What the? That's a freaking connective tissue. And they're going to get excited, and they're going to become activated, and they're going to activate other cells. And they're also going to bring in our fibrinogen, our clotting factors, and wind all this around and form ourselves a blood clot. Okay? And it's because of what they've been exposed to. They're getting exposed to something they don't normally see or contact, which is either connective tissue or other factors. Okay, so thrombin converts soluble fibrinogen into fibrin. Fibrin is a sticky thread derived from a soluble protein called fibrinogen. Fibrinogen normally just flows along with the blood, but thrombin converts it into fibrin. And it forms a sticky network that wraps up our red blood cells. And then they also will gradually contract. They have almost like some actin and myosin in there. They'll contract and then consolidate that blood clot. Now, blood clotting happens by one of 2 ways, the extrinsic mechanism or the intrinsic mechanism. Intrinsic means within. Okay? Extrinsic means from outside. So this is the intrinsic pathway. This is the extrinsic pathway. Which one looks simpler to you? Extrinsic. Intrinsic involves a lot more cofactors going on there. If you were taking a higher level class, you would learn the names of all these different factors that help to assist with blood clotting. Suffice it to say that in the intrinsic pathway, the clotting is initiated by negatively charged surfaces, for example, collagen molecules, activated platelets, things like that. But it's a slow process because there's all these different steps. Okay. So the primary stimulus for this intrinsic pathway is these activated platelets or exposure to collagen fibers within the blood vessels. Now the extrinsic pathway is initiated by factors outside the blood vessels. This is called tissue factor, and it's much more straightforward process. It's much faster because there are a lot fewer steps going on here. Okay. So normally we're going to have both the intrinsic and extrinsic pathway going on in order to help us go through the process of hemostasis, to stop that blood, stop the blood vessel from continuing to bleed. Okay, these are examples of anticoagulants. Why would I want to use an anticoagulant? Yeah. Or so you don't get a clot when you're giving IV fluids, right? They're going to flush that occasionally. Before they hook you back up, they'll take a syringe and flush a few mils of saline through there. Sometimes it'll be heparinized saline. And heparin is probably the most common anticoagulant that you're going to use in the veterinary clinic. So heparin is commonly used in the veterinary clinic. Other things that are used in human health, Coumadin, warfarin, things like that. Even aspirin can be used as an anticoagulant. Again, not in the veterinary clinic, but heparin is the one that you're going to use. Here's another anticoagulant that your dog might get a hold of. Okay, this is rat poison. Okay, most common rat poison, well, I guess up to recently, is warfarin. Okay, and warfarin is a very powerful anticoagulant. It kills the rats and mice by causing them to bleed out. And if your dog gets a hold of it, it can cause them to bleed out as well. Does anybody know the treatment for this? Not? Induced vomiting is one. Vitamin K. As it turns up, vitamin K is needed for the clotting cascade, and this binds up a lot of the vitamin K. So that's when the doctor in the clinic will say, well, we're going to make that animal barf if it's been just a few minutes since they ingested the poison, and also give them a dose of vitamin K and monitor their blood closely. We already talked about intravascular clotting. We said that that was thrombosis, and that when that clot breaks loose, it becomes an embolus, and that's problems as well. Okay, on to leukocytes. Hopefully we'll be able to finish these things off. Leukocytes do not carry oxygen. Their primary job is in defense of the body. Sometimes we say it's immune defense, but immunity really has to do with a certain type of defense. But in any case, our white blood cells are there to destroy bacteria, cancer cells, infected cells, get rid of viruses, worms, and so on. And so, in comparison to the red blood cells, they're pretty rare. If you ever looked at a slide and saw this many white blood cells, something's wrong with that animal. Okay? Because white blood cells can become elevated in numbers during certain types of infections or body conditions. This is great. I think somebody probably photoshopped all these cells in, but usually to see all the different white blood cells, I would have to go through 8 or 10 rows on a slide and spend 5 or 10 minutes looking at it. It'd be very rare to see this many white blood cells in one field of view. Okay, so compared to red blood cells, they're rare. They do have nucleuses. They're also, in general, a lot bigger. If the red blood cells are 7 microns, these white blood cells can be 10 microns, 12, even 15 microns, so they're pretty big. They don't carry hemoglobin, and they're classified as granular or agranular. Either they have granules or they don't. Okay, just like our red blood cells, they're made in the red bone marrow. And then some of them, the cool thing is, can actually leave the blood vessels and migrate within the tissue. Okay. They're all made in the bone marrow. Most of them actually hop a ride on the bloodstream, but many of them spend a very short time in there before they move out of the blood vessels and into the tissues. Okay, and the process they do that is called immigration and diapedesis. If we look at a white blood cell like a neutrophil or something like that, it rolls along the inside of a blood vessel. We call this a margination. and eventually it can sneak out the gaps in between the epithelial cells that make up the wall of the blood vessel and then make its way into the tissues. Now, sometimes they do this automatically. Sometimes they do this through the process of chemotaxis. What does chemo mean? Chemical. And taxis? What's a taxis? It's the yellow things you get into to go somewhere. That's where the word comes from. Taxi is going to take you somewhere. In this case, it's a chemical that causes the white blood cells to change their behavior, to move out of the blood and move into the tissues. Sometimes that chemical could be chemicals secreted by damaged tissues, or sometimes it's a bacterial protein. Anyway, it's a way to tell that white blood cell, hey, you're needed out here. Okay. Oh, I just put this slide here. This is something you're maybe doing this semester, probably next semester, is just making a blood smear. Has anyone done this before? Okay, so Joanne's done it. Anyone else? There's an art to this. So when you get a chance in lab, do it 100 times and you'll get decent at it. But we do blood smears so that we can look at the relative numbers of the white blood cells to each other and also get an idea of the morphology and the shape of the red blood cells. So when you take the lab techniques class, you'll do a lot of blood smears. You'll probably each do at least 300 or 400 blood smears in the semester. Okay, so the first type of leukocyte we're going to talk about is something called a neutrophil. Sorry, a neutrophil is a granulocyte. Now, granulocytes have granules, but in this case, the granules in the neutrophil are neutrophilic, meaning they don't stain very well with either the basic dye, the purple dye, and they don't stain well with the eosin. So we don't see the granules in here. But we do see that they have sort of a U-shaped nucleus, and that nucleus initially is very smooth. That's what we call a band cell. But as that cell gets older, it gets more and more segmented. And so the number of segments in there can tell us a little bit about the age of that neutrophil. Really segmented ones, you want to think, that's an old neutrophil. Now, neutrophils are the first responders. They're like the firemen that get to the infection first. They're phagocytotic, and what does that mean? They eat other cells. So they see a bacteria cell, they go nom, 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 nom. You know, they're going to eat it all up. Okay? And they're generalists. And even once they ingest that bacteria, it's not dead. The way that they kill it is through either something called lysozyme, just an enzyme that perforates the organism, or through this. What is H2O2? Peroxis, hydrogen peroxide. So it uses hydrogen peroxide to kill some bacteria. Now the cool thing about this is that neutrophils, your body and your dog's body is making a lot of neutrophils because they only spend about 10 hours in circulation. After 10 hours, no matter what, they're moving into the tissues. And they're beginning to move to sites where there potentially could be an infection. Okay? And think about this. If you've ever had a pimple that's arisen overnight, right? It was nothing the night before and you wake up and you're like, good God, there's this thing on my face. That pimple pus is full of neutrophils. And they've been amassing, moving out of the out of the bloodstream and moving it into that abscess overnight. So they're very, very good at migrating to the site of infection. Okay, the next guy is called an eosinophil. Now, eosin is a stain that we use in blood stains, and it stains things pink. And so an eosinophil has granules that stain very brightly with this pink to orange dye. That's why we call them eosinophils. The nucleus in these guys usually looks like an old telephone. Does anybody know what an old telephone looks like? Yeah, before we had cell phones, so it's kind of like that. If you can see the nucleus at all. But the big thing to look for is the granules, the pink staining granules. Eosinophils are important because a couple reasons. One is that they seem to become elevated in times of chronic parasite infestation. For example, parasitic worms, protozoa, things like that. If we have large infectious bodies, they're going to be taken care of by our eosinophils. We also think that eosinophils help to mediate the severity of allergic reactions. That is, we're starting to have allergies come up. The eosinophils produce some substances that reduce the body's reaction to that allergy. Okay, the next one is our third granulocyte called a basophil. These have granules, but here the granules in most species are going to be dark purple staining. That's why we say they're basophilic. They stain with a purple basic dye. And sometimes you can't even see the nucleus. So the equine basophil and human basophil look pretty similar to me. They're just like a big spiky ball of granules. Basophils secrete a couple things. One, they secrete histamine. What does histamine do? Inflammation. Okay, yeah. If you've got inflammation and your snot coming down and stuff like that, what would you take? An antihistamine, right? Okay, you don't go to the store and buy histamine. That's just going to make it worse. The other thing that our basophils do is they secrete heparin, again, which helps to prevent coagulation. So basophils initiate the allergic or inflammatory response, whereas eosinophils try to moderate it. Okay? Both eosinophils and basophils are very, very rare. Okay, and finally we have a special cell that's not a circulating cell, but found within tissues called a mast cell. I don't think do you have this on your slide? Okay. So mast cells are sort of like basophils that only reside within tissues. And they have different jobs. They are important for initiating the allergic response, inflammatory response. They also, we think, are important for getting rid of some pathogens. But we do know that in dogs, that one of the most common skin tumors, aside from a lipoma, would be these mast cell tumors, where we get these collections of mast cells that can cause a very large tumor that has to be removed and can sometimes metastasize. Agranulocytes. Agranulocytes don't have any granules. Okay? And examples here include our monocytes that look like a big U horseshoe-shaped nucleus. And they're our largest white blood cell that turns into something called a macrophage. What does macro mean? Big, large. And so these cells go from being something like this to a giant cell that, you can't see the teeth on it or anything like that. It becomes this big eating cell and can gobble up lots of different types of pathogenic material. So they help get rid of bacteria. They also help to destroy just damaged tissue. Okay? And so they're really important. They're not the first responders, but they're the ones that come in after the neutrophils and help to continue to battle certain types of infections. So we see them become elevated more during chronic infections. Okay, last but not least, our last agranulocyte is called a lymphocyte. And they are just little tiny cells, about 1.5 times the size of a red blood cell. They're mainly purple, except you can see a little cytoplasm around the outside. People sometimes confuse them for basophils, but they still have this ring of cytoplasm that basophils do not. Okay. And they're the ones that participate in what we call immune response. And they're important because they produce antibodies if we're a B cell, but they all also have immunological specificity and memory. They are specific. They're not just like the regular army. These are the Navy SEALs, and they have one target. They're only after a certain type of bad guy. They're very specific to their pathogen, and they also have memory. Once they encounter a certain pathogen, they will remember it and be able to respond more efficiently to it in the future. So those are a couple different types of white blood cells, and it's important to know that each of them occurs in a certain percentage relative to another, but this varies within species. So here are the ranges for cats and dogs. And you can see it's a wide range. But in cats and dogs, neutrophils are the most abundant and basophils are the least abundant. So if we see an increase in neutrophils beyond this number, it sometimes indicates a bacterial infection. So we can look at a complete blood count or a differential count and say, oh wow, this animal might have a bacterial infection. Lymphocytes, we can look at increases for chronic infections. Monocytes, we might see an increase with bacterial or fungal infections. And finally, eosinophils, if we see those increased, we want to think, oh gosh, is there some kind of parasitic worm infection, or is there something going on with an inflammatory response? Because both basophils and eosinophils may become elevated during an inflammatory response. So you need to memorize the order, and the way that we do this is just using this mnemonic. Never let monkeys eat bananas. Okay? So never for neutrophils, let lymphocytes, monkeys, monocytes eat eosinophils, and bananas as basophils. Now this is for cats and dogs, and for people it's different for ruminants. Okay, does anybody know the most abundant white blood cell in ruminants? according to your book, it's a lymphocyte, which is interesting. But knowing these average, percentages we showed on the last page and which ones are most abundant can help you sort of spot, maybe not diagnose, but spot potential trouble by examining a blood smear. So here's what you're going to be doing next semester in Sam's class. You're going to be doing lots of blood smears, and you're going to be doing a lot of white blood cell counts. Okay, traditionally, you'll count the first 100 white blood cells that you see on the screen and try to identify them and then figure out their relative percentages. So how many cells, total white blood cells, do you see on the screen? 8. Okay, so our denominator is 8. We've got 8 white blood cells on the screen. And now let's try to identify them. What do you think this guy is? It's a granulocyte, but which one? Okay, we heard monocyte and we heard neutrophil. This is in fact a neutrophil. We sometimes call it a seg because it's segmented, right? So are there any other neutrophils on there? That guy. So 2 neutrophils. So go ahead and write that down next to your N. 2 neutrophils. Okay, what's the next one we're looking for, you think? Should be lymphocytes. So lymphocytes, how many lymphocytes do you see? Is that a lymphocyte? Nope. How does it look different? This is a lymphocyte. The ring. Look at the ring of cytoplasmic material. Same here. This is a lymphocyte as well. This one is just a gloppy mess, and it's kind of granular. So what could that be? Basophil. And again, this is a human smear, so they'll be a little bit different, but it's a one where I had all the cells on the slide. So we've got 2 lymphocytes, 1 basophil, okay? And then what about this guy right here? Monocyte. Okay. How can you tell it's a monocyte? Big nucleus, and it's a big cell. It's about twice as large in this case as a red blood cell. So we're talking about 14 microns, 15 microns across. Okay, are there any other monocytes up there? This guy is also a monocyte. Even though it's not horseshoe, it's got a kidney bean shape, that's a monocyte as well. So we've got 2 monocytes. And this brings us to our last guy. I heard somebody whisper eosinophil. Why do you say eosinophil? Because it's red. It has pink to red staining granules. That's an eosinophil. Okay. So overall, we should have 2 neutrophils, 2 monocytes, 2 lymphocytes, I believe, 1 eosinophil, and 1 basophil. So writing those down and knowing that there's 8 total cells that we counted, what is the percentage of neutrophils? 25%. Yeah, 2 over 8, or 1 over 4, 25%. So neutrophils, 25%, monocytes, 25%, okay, and then lymphocytes with 25%. And what about the eosinophils? 12.5%. Basophils, 12.5%. Again, this would be sort of unusual, but we're normally going to count a lot more cells than this. Normally, you've got this little device, and you click in, and when you get to 100 cells, it goes ding, and it tells you to look at your values, and that'll give you your relative percentage of white blood cells to another. So it's really important to realize that, let's say if we saw 50% eosinophils, what could that mean? Okay, what's the normal percentage of eosinophils? 2 to 7. Sometimes we'll look at a whole slide and we'll never see an eosinophil and we'll never see a basophil, and that is completely normal. If we see 25% eosinophils, what might we think? We might think parasites or inflammation. Same with basophils. If we see 10% basophils, something like that, that could be pretty high. 15% basophils, we want to think about, is there an inflammatory response going on? Why do we see more basophils? And then, same thing with neutrophils. We see a lot of neutrophils. We're going to think bacterial infection or recent infection, okay? Because the neutrophils usually aren't that, they're about 60% abundance, but if they go beyond that, it means they're being produced to deal with maybe a certain type of infection. Okay? So this will become important later on when we look at blood smears in 151 lab. Okay, now we can also put this blood through a machine. It will crank out the absolute numbers of these cells, which is important to know too. And then it's great. It's got the idiot factor built in. It tells you, okay, that is abnormal. Those are abnormally high. And so you can look at the machine's printout and say, okay, eosinophils are high. But honestly, your eye is better than this machine after a little bit of practice. And so if you're not sure, Sam will drive this in your head. It's always good to do a smear and follow up, validate that machine's response, because it has a harder time recognizing these cells than you do.